A 32-year-old female with claustrophobia, fear of closed spaces, is stuck in a normal functioning elevator. She experiences severe anxiety as well as dizziness, weakness, and blurred vision. The question is, which of the following is the most likely cause of this patient's symptoms? Your options are: Choice A, decreased arterial partial oxygen tension. Choice B, decreased arterial oxygen content. Choice C, decreased arterial partial carbon dioxide tension. Choice D, decreased arterial pH. Choice E, increased arterial lactate content. Type your answer in the comment box. Congratulations if your answer is C, which is decreased arterial partial carbon dioxide tension. The patient in this vignette is having a panic attack. Panic attacks are typically accompanied by hyperventilation and decreased partial pressure of carbon dioxide, also known as hypocapnia. Hypocapnia can cause decreased cerebral perfusion and thus neurological symptoms. When the arterial blood pressure is maintained in the range of 60 to 140 millimeter mercury, the arterial blood gases exert the most powerful influence on the brain circulation. Carbon dioxide, a potent cerebral vasodilator, exerts the most significant effects. An increase in the partial pressure of carbon dioxide from 25 to 100 millimeter mercury causes a linear increase in cerebral blood flow, and a decrease in the partial pressure of carbon dioxide causes a linear decrease in cerebral perfusion. Because hypocapnia can decrease cerebral blood flow, patients with cerebral edema are often hyperventilated in order to decrease intracranial pressure. The partial pressure of oxygen has much less of an influence on cerebral blood flow. For partial pressure of oxygen in the range of 50 to 100 millimeter mercury, cerebral perfusion remains constant. Severe hypoxia with partial pressure of oxygen less than 50 millimeter mercury leads to a rapid increase in cerebral blood flow and intracranial pressure. Other vasoactive substances in the systemic circulation do not affect cerebral blood flow because they do not cross the blood-brain barrier. If you chose any option other than C, you were incorrect. Let's briefly discuss the other options. Choices A and B cannot be the answer because hyperventilation does not decrease the partial pressure of oxygen or the arterial oxygen content. If anything, these parameters would increase. Choice D cannot be the answer because hyperventilation produces respiratory alkalosis, marked by an increased arterial pH and a decreased partial pressure of carbon dioxide. Choice E cannot be the answer because increased arterial lactate content is a sign of tissue hypoxia. Example from ischemia, cyanide poisoning, carbon monoxide poisoning, seizures, or sepsis, and is not associated with panic attacks. Lactic acidosis is also associated with metformin use. If you're finding this difficult to understand, consider watching this episode again.